Welcome to Life on Purpose, where we talk all things health, wellness, and living your life on your terms. I'm your host, Brandy Eilert. All right, welcome back to the Life on Purpose podcast, where today my guest is Dr. Peter Kozlowski, Functional Medicine M.D., and author of the book, Unfunk Your Gut, Boost Your Immune System, Heal Your Gut, and Unlock Your Mental, Emotional, and Spiritual Health. So welcome to the show, Dr. Kozlowski. I really appreciate your time. I want to dive in. So functional medicine is kind of like my gateway drug into the whole health and wellness world. So I really appreciate this conversation.
Nice.
So let's go ahead and dive into you. I mean, because you started kind of you went down the traditional route of medicine. Yeah. So how did this all play out for you? Why functional medicine? Why did you choose this path?
Yeah, definitely. If you would have asked me when I was growing up, medical school, residency, when I started, and you would have told me I'd be doing functional medicine, I would have laughed in your face and made fun of you. So it was kind of just my story is a little different than most MDs that go into functional medicine, in that most have a physical illness like an autoimmune disease that they try to heal with regular medicine, and they can't. So then they search alternatives and they find functional medicine. I had a mental illness. I had alcohol abuse issues, and that's what led me down my journey. And so when I was in residency, I went through medical school, got into residency. Everything was going amazing. And I tried to cut alcohol out of my life. I always laughed when we learned about alcoholism in medical school. I was like, this is definitely, like, I fit all the criteria, but I was just like, this isn't me, because I'm doing great. Everything's going well.
You were functional.
Very.
Right.
So I tried to stop drinking, and I had no clue how to just do life. I was totally lost. And so I drank, and then I decided to go to treatment. So I went to a 6 week, partial inpatient treatment. And the 6 weeks had nothing to do with alcohol. It was all about why. And so that's where I was introduced to the underlying cause thought process.
Right.
And we were doing things like yoga, meditation, prayer, exercise, all these different things that I was like, this stuff doesn't work. This is all full of crap. And it was working for me. So I did that. It obviously changed my life. And then I went back to residency. And as a resident, you're taught by different doctors every day, every week, every month. You're learning from somebody different.
Yeah.
And we had one doctor that we worked with that every time we worked on the inpatient service, so when we were seeing hospitalized patients, he would have us order a multivitamin and vitamin D. And we thought it was a joke. We were like, why is he wasting our time with these supplements when we could be prescribing meds? So I asked him one day, and he's like, well, I'm studying something called functional medicine. And he took me to the website, and we looked at it, and I was like, this looks interesting, having been through what I just went through. And so I signed up. I was like, you're required to do CME. They pay for you to do it. So I was like, screw it. I'll go check this out. And within the first hour of the first lecture, I was just blown away. How was I not taught to look at medicine this way?
Let me pause really quick. What was it about him saying, let's order this multivitamin and vitamin D that made you immediately be like, this is crazy, when what you know now points into the direction of, okay, maybe this is what we should be, how should we should be thinking all along? What was it about it? Just kind of the thought process there.
I think honestly, and this is my opinion, traditional medicine is basically taught by the pharmaceutical industry. We learn basically anatomy, what can go wrong, and then what medication to fix that. There was never through medical school and residency any discussion of like, what are the nutrients that could be supporting this process, or what exactly in our environment is causing this process to malfunction. It's just what medication are they going to make the most money off of, and what's the newest and trendiest drug that they can sell.
So basically taking a list of symptoms and matching them up with a pharmaceutical.
Yeah.
Yeah.
That's my experience and my opinion of traditional medical training. It's the only reason I can make sense of like why this stuff isn't taught. I mean, now having practiced for 10 years in functional medicine and seeing just people's lives completely change, it's I don't know, it's sick. Like it's infuriating that this is not the mainstream, that people have to, just like me. I mean, I had to spend a lot of time and a lot of money to learn functional medicine. Like, it was not cheap. So for most patients, it's the same thing. Like, to work with somebody in functional medicine, it's not cheap. The insurance doesn't believe in any of it, so they don't want to pay for it.
Right. And I think that's an infuriating part, because even so like me personally, when I was kind of at the end of my rope with my health, and that's how I found functional medicine, because it was out of desperation. It was like, can I even afford this route? And I think what people need to realize is sometimes you can't afford not to. You can't afford not to take this at least as an option.
The way that I kind of describe it is like the functional medicine versus traditional medicine. Traditional medicine is like the best business model in the history of the world. It's get customers at an extremely young age, keep them sick and as alive as long as possible. And you've got a recurrent customer for life. My typical patient, I usually stop hearing from them like within 3 to 6 months. So they spend more money than they would at the regular doctor up front, but then all the costs down the road go away. So it's, you know, and I'm happy that way. Like my job, like, help you figure it out, and then like you don't need me anymore. But that would be a very bad business model for the drug industry.
Well, and to kind of go back, do you feel like, though, the traditional MDs, I feel like the ones that I have met, at least, feel like they're helping, but just like you didn't know that there was another way, given that that's not the education that they are getting.
It's not even just taught that there's not another way. It's almost like you're told that the other way is bad and wrong.
Right. And we definitely run into that as well. Well, let's get down to the nitty gritty. How would you describe, for somebody who is just discovering this other way, how would you describe functional medicine? What is it? How does it work for somebody?
The point of it, as a regular doctor, I was taught, like I said, to listen to your symptoms and give you pills for them.
Yeah.
As a functional medicine doctor, I'm taught to listen to your symptoms, plot your story throughout your life, identify points where illness could have been, things could have contributed to illness. And then, so figure out what is imbalanced in your body. Mm-hmm. And then once we find the imbalances, whether it's too much of something or not enough of something, we fix those balances in order for you to feel better. Yeah. So I always warn people at the first visit, I'm like, I'm not like giving you a plan to feel better. Usually, like, the plan is to address what's imbalanced, and then eventually you'll feel better. Right. So whereas as a traditional doctor, I'm like, here's a pill. Hopefully by tomorrow your symptoms are gone, so you don't come back again, and I can see the other, the large amount of patients that I need to see.
So it's not about masking your symptoms. It's about getting to the bottom of them and kind of, working that back into balance so that eventually you will feel better. Do you feel like we have kind of conditioned ourselves to want just immediate results, and so that functional medicine, that route, can be kind of frustrating for people?
100%.
Yeah.
I always say it only works if you work it. And I learned pretty early on in my practice, we frequently will get a mother calling for a child or a spouse calling for a partner, that are like, hey, I want to schedule a visit for Joe. And we would do that, but then the people would come in and it's like they don't want to be there. Yeah. There's no hope for functional medicine to work. Like we don't have like magic pills that make you feel better. That's what traditional medicine is.
Right.
So now, I mean, so we changed our policy. We're like, that's fine. We can schedule a visit for whoever, but we need to talk to them first.
So kind of a consultation of how invested are you in this process? And do you feel like there's an education part of it? Like, this is what it is. This is going to be difficult. This is all on you. I can give you a plan, but this is you having to actually do the work.
Over the last 10 years of doing it, an initial visit always with me was always just education.
Yeah.
And because I think that's our greatest job as practitioners is education. So all of that I put into my book. That's kind of why I wrote my book. And it's
yeah.
The feedback I've gotten from patients is that even if they don't come to see me, they're like, well, I saw another functional medicine person. And in some cases they're like, I knew more than this person did. Yeah. Or like, I just felt very prepared for my visit. It is because it's a totally different way to think about most of the way we've been trained about health. So to me, like, it has to be understood.
Absolutely. And I think that the patient needs to be absolutely prepared for what the process is going to be like, because like you said, if you go in and you are conditioned to say, okay, these are the symptoms, this is what you have, take a pill, feel better, where this is a process almost of getting to know your body, getting to know kind of your symptoms and these kind of red alerts of, okay, well, this is how I'm feeling. This is probably, a flare up or whatever. And this is what I need to do to calm it down. This is where it's coming from. So it's really what I have found of really getting to know yourself. And sometimes that's hard for people. Because, and this is something I really wanted to dive into with you too, because the mind body connection, nobody really wants to put those two things together. Right. And you did you train under, I think I had it in my notes, Dr. Hyman and Deepak Chopra. Right. So two of, the greatest minds in the mind body connection is so important in this area of functional medicine.
It's my most passionate subject in functional medicine. And that, for like a spoiler alert for people that haven't read my book, it's the key to your gut health is your mental, emotional, and spiritual health. And it's really interesting for me because people that I work with are so willing to be like, okay, I can only eat 3 things a day. I have to take 10 supplements a day. I've got to do these 10 tests. I've got to detox for 2 years. All of that is fine. I'll do that. But when I want them to look at like trauma from their childhood or look at their relationship or look at how much time they're spending in Facebook groups reading about what could be wrong with them, it's like huge roadblocks go up. And I warn my patient. I mean, I'm pretty blunt, I guess, as you can see, is like, I tell people, I'm like, if you don't make your mental, emotional, spiritual health the focus of your health, there's not a lot of hope for you to get better. Like, it very rarely in my experience has it been as simple as like, okay, we just need an elimination diet, or we just need to treat SIBO, or we just need to detox from mold. Most of us have been through some stuff and we're usually denying. And I know all about that as being as someone in recovery. So that's the key. But it's the most important part of functional medicine. It's probably the least talked about. And it's the most difficult to do. I mean, it's hard. It's really, really hard.
Right. Because if you tell somebody, hey, you've got to look at the dark places and really deal with them if you want to really, really heal, who wants to hear that? I mean, who wants to do the hard stuff? Like you said, I mean, you can you can be on the most crappy diet ever and like eat, a handful of foods and whatever. And that's difficult. I mean, I have done all of those things and that is difficult, but to really explore all those deeper areas, that is scary for people. That is really scary for people.
Yeah, it's terrifying.
So let's talk about how that actually does work. How does this emotional, spiritual piece connect with the physical gut health, and gut health being, the pivotal point and the pivotal area of overall physical health?
It's basically your vagus nerve.
Mm-hmm.
So the way that your mental, emotional, and spiritual health affects your gut health is because your brain and gut are connected and they talk to each other. There's signals that go up from your gut to your brain, and there's signals that go from your brain to your gut. They are mostly they're carried by what's called your vagus nerve, which is one of your cranial nerves.
Mm-hmm.
The gut has its own nervous system called the enteric nervous system. So when I say gut, I mean the tube that starts with the mouth and ends with the anus.
Mm-hmm.
And that whole tube is aligned with this nervous system that is talking to the central nervous system. There's more neurons in the gut nervous system than there are in the brain.
Mm.
And so the vagus nerve runs on your autonomic nervous system. They call it like your primitive nervous system. It's in your subconscious. You don't think about it. It has two responses. One is sympathetic and one is parasympathetic. Sympathetic is fight or flight. Parasympathetic is rest and digest. The analogy I give now that I live in Montana is if I'm out hiking in the mountains and I see a grizzly bear, sympathetic nervous system is activated. The energy and blood go to my brain and muscles to figure out how to survive, how to live. And then if I do survive and I'm sitting by the campfire, having a s'more or whatever, I'm in rest and digest, right? And all the energy is going to my gut to break down the food that I'm eating.
Mm-hmm.
The last thing, I mean, our bodies are really, really smart, right? There's a reason we've evolved and survived. And so they protect us. And so when the body thinks it's under attack or in danger of dying, it will protect itself. Well, what effect does it have on your gut? It shuts down your stomach acid production.
Mm-hmm.
Acid is produced in your stomach. It is what starts the digestive process after chewing. Acid is how you get vitamins and minerals out of your food. Acid is how you kill off all these bacteria and viruses and parasites we're being exposed to. So you need lots of stomach acid. Polar opposite thought process than regular medicine. The 7th most prescribed drug in America is an acid blocker. There's entire sections of acid blockers.
Wow. So you could be having, all these patients with actually low stomach acid, and you're prescribing them medication to stop it altogether. So you're essentially adding to the problem.
Yeah. The symptoms of low stomach acid, what makes it worse, look exactly like the symptoms of what people think of too much stomach acid.
Gotcha.
And again, the difference comes down to, in my opinion, that they've designed and profited off of many drugs that block your stomach acid, but the way you boost your stomach acid is naturally.
Yeah.
Right? And so that, I think that, because people are like, why doesn't my, over 90% of GI doctors, maybe 99%,
mm-hmm.
never tell you like, oh yeah, you need more stomach acid than you have too much. And I can't tell you the number of people that I've seen that have low stomach acid. It's more than 50% of the people that come to my office, because most people that come to me have got a lot of stress.
Right.
And so your stomach acid is shut down. The whole protocol of like how to test yourself and address it, I did list in my book because it is so common.
Yeah.
So you can test yourself at home. And then the small intestine, your pancreatic function is decreased because your pancreatic enzymes need acid to be activated. Your detox capacity from like your liver is suppressed. And then we get into the large intestine, your microbiome, my favorite area to talk about, the 3 to 5 pounds of bacteria. we can actually see how stressed out you are based on a stool analysis.
Mm-hmm.
You literally shut down good bacteria from growing when you're stressed out. So the whole gut is screwed up, right? From that sympathetic response.
Right.
And the other thing that I forgot is in the small intestine is it causes leaky gut. And that's the most important concept to understanding why the gut can create any kind of chronic disease, is because the gut is the gateway into your body.
Right.
The inside of that gut tube is considered outside of your body. If you swallow something and poop it out, it's never been in your body. So the gut has these they're called gap junctions and microvilli in your small intestine that allow you to absorb nutrients and keep the toxins out. Well, when you're stressed out, those junctions stay wide open, and anything that's flowing through your gut can then flood in your body. Now it's in your bloodstream. Your immune system's waiting there. Your immune system is identifying this is good or bad, and it'll attack if it's bad, creating inflammation. And once you've got inflammation, then in the blood, what happens with the blood? It goes everywhere,
Right.
from your head to your toes, right? And that's why I could take 100 people with a gluten sensitivity or SIBO or mold or candida, and they all have different symptoms. And it all started in a lot of people with the stress or trauma, which damaged their gut, which let our environment that's getting more and more toxic every year into our body.
So not only are you living in a chronic state of stress, but you're living in a chronic state of inflammation then.
Exactly.
Which, we all know how awful inflammation is long-term. So what are some of I guess whenever you have a patient come in and you're going through all the symptoms, what are some of the most seen kind of toxins or conditions? What are some of the most popular conditions, I guess, that you're seeing today?
So there's 5 main areas we look in functional medicine for inflammation:
Mm-hmm.
food, gut health, hormone imbalances, environmental toxins, and mental, emotional, and spiritual health. So within those 5, there's food sensitivities, there's candida, dysbiosis, SIBO, low stomach acid, leaky gut, estrogen dominance, low testosterone, low thyroid, high thyroid, adrenal fatigue, mold toxins, heavy metals, lead and mercury, and then stress and trauma. So those are the main areas that we look.
And those, and I've talked about this on past shows too, where everybody kind of wants a quote unquote diagnosis. I want to give a name to what's happening to me. But in reality, I mean, it is so many different things that are happening to you. I could have Hashimoto's, Graves' disease, adrenal fatigue, but really I have too much stress, toxic overload, food sensitivities, etc. I mean, just because you give it a name, we're looking essentially at just imbalances, correct? I mean, do people really need these labels to feel better about, I guess, give a name to what's going on with them?
No, that's a good question. I mean, I will a lot of times tell my patients, I don't particularly care what your diagnosis is.
Right.
And that's another like traditional medicine thing, that they're like obsessed with finding like this type of gut bacteria equals diabetes. This one equals obesity.
Yeah.
The analogy I always use is we all have a bucket, and we fill that bucket with toxins and gut issues and stress and relationships and all this stuff. And eventually that bucket overflows. And one person's bucket overflowing could be thyroid disease.
Yeah.
The other person could be rheumatoid arthritis. The other person could be hypertension. And usually we're trying to identify what's causing that inflammation. And when we get rid of it, whatever symptoms will usually get better.
So overall, it is all the same thing. It is all imbalances. It is all toxicity. It is all stress. It comes from the same places. We are just giving these symptoms or wherever they manifest different names. So, my bucket overflowing manifests as thyroid disease or adrenal fatigue. Another person, their bucket overflowing is, arthritis or lupus or, what have you. So how important is it for patients to understand that, just because we're giving it a name, we're not going to fit like this one size fits all protocol into this, rheumatoid arthritis area or Hashimoto's area?
I mean, I see that even in the functional medicine world, because most people that come to me have already been to another, some kind of alternative practitioner.
Mm-hmm.
And we could see that too, where people are like, well, no, it's, I was diagnosed with adrenal fatigue. This is like the one issue. We just need to fix the adrenal fatigue. And I'm like, usually, actually, it's interesting. The more convinced that a patient comes into me, like that they have a mold toxicity or that they have a candida overgrowth, the more likely it is that that's not going to be the issue. And so I have to have those conversations and be like, because I've seen it go. I mean, someone spends 5 years convinced they have mold, and then they do their mold test and it's negative. And it's like they built their whole identity around being mold toxic for 5 years. And so it's that there's a lot of frustration and anger. And so I just try to be very upfront. I'm like, my experience is that this is not going to be one thing, even from a functional medicine perspective.
It is really interesting what those labels do, what putting a name to it does, and how you can get kind of stuck in this box, when really, if you strip those labels away and we just look at it as, we've got some sort of imbalance that's manifesting in a certain area, I think, people are more willing to continue to dig and look and do the work to get better, to heal, to make it better. So that is a really interesting paradox a little bit, these labels that kind of really hold us back. So as far as like toxins go, what are some of the most common toxins? I think that's a really big question that always comes up. And I remember it being a really big question of mine. What are these toxins? Where are they coming? What am I doing? Or environmentally, what's happening? Because we've seen this explosion in autoimmunity and allergies and food sensitivities, and what's happening?
So toxins are not even just environmental toxins like the lead and mercury and those things. Toxins could be coming from the gut bacteria. Toxins could be coming from stress. Toxins could be coming from food. And they're basically, toxins in general are just things that kill our cells. And when our cells start dying, then the systems go wrong, and then there's symptoms. As far as specific to like environmental toxins, the two most common ones that I work with are heavy metals and mold. If I had to pick just one thing that should be screened by like your general practice doctor, like maybe every 5 years, would be heavy metals. And it will never be that way. But the two main heavy metals that we see are lead and mercury. I see a lot of cesium and thallium, gadolinium, barium, arsenic. And that stuff's everywhere. I mean, lead is an airplane exhaust. So being from Chicago and growing up by O'Hare, I mean, everybody there has some degree of lead elevation. Then you throw in like that they used to put it in paint and pipes and food. So we're all being exposed to it, and they cross the placenta. So a lot of people are born with a bunch of heavy metals because their mom never knew that she had them. And
so that's really interesting too. So you could already be loaded up as at birth and then continue to accumulate throughout. So, we've seen, I don't know, probably even just in the last 2-3 decades, this almost acceleration of these chronic issues starting even in childhood. And that is a really good point, that if you are already born with a certain level of toxicity, of course, you're going to see it happening younger and younger and younger. That makes complete sense.
Yeah.
What kind of effects do these, especially like heavy metals, have on people and people's health?
There's 3 to 4 main systems that they affect, and it's the immune system. So anybody with an immune condition like Hashimoto's should definitely be tested. The neurologic system, so things like autism, dementia, MS. The reproductive system, which is in women, estrogen dominance, in men, low testosterone, infertility. And the 4th one is cardiovascular. I've had patients that came in on 3 high blood pressure meds, and after chelating and getting the heavy metals out of their body, they're off of all of them. So it's, within those 4 systems, there's a lot of diseases that are very common. So like I said, I mean, that's the heavy metals and your microbiome are the 2 things that, like, even if you're healthy and everything looks good, I would still test, because it's something that could cause disease down the road.
So how difficult, so somebody comes in and they have elevated levels of certain heavy metals, and you go through the process of detoxing. What does that look like? How difficult is that? And how difficult is it to then maintain, like, once you actually have gone through that detox and you see some results?
I use chelation therapy, which, again, in the functional medicine world, some people don't use. I've used it for a long time. That basically means taking a medicine that pulls the metals out of your body. And that medicine that I use is called DMSA. It's not something that could be given every day. We basically give it like 8 days out of a month. And the rest of the month, we're replenishing your body, because it can also deplete some nutrients from your body. So I use chelation therapy, and in general, it's actually pretty easy. Like, it's just remembering, like, the medication does the work for you. It's just remembering what to take on what days. And you don't, like, to me, I don't do a specific diet or anything. I mean, lifestyle related. I mean, I want everybody to be exercising and sweating and things like that. But in general, to me, like, chelation is usually pretty easy, and it's very effective. Like, it works in everybody.
And do people, I mean, you kind of always hear, like, when you're talking about chelation, hear of like these awful side effects of just feeling completely crappy. Do you have that? I mean, do people have that experience when they're going through the process, or is it fairly tolerable?
It's more frequent in people that have read about it before they meet me. So
self-fulfilling prophecy.
Yeah, I mean, the first chapter of my book is basically making fun of the internet. And
we all need to do a little of that.
But it's real. I mean, I've seen it to the degree. I've seen a guy that was in his 30s that was in a wheelchair, and I'm pretty sure it was because of he just convinced himself he could never heal. So at the same time, I get that functional medicine wouldn't exist without the internet. So my advice is basically to find a doctor or practitioner that you trust, and then stop Googling what could be wrong with you.
I think that goes across the board in all areas of medicine.
Yeah. But it's very hard for people. I had a patient the other day that I told her, I gave her a goal of 1 month of no health podcasts, no social media groups or whatever. And she had the same response that I had when somebody told me to stop drinking. Like it was identical. So I think it's bad. And so there's a lot of stuff written about a lot of these things, Candida or SIBO or chelation, that it's going to be bad, or it'll never work, or this will never heal. All the people that are online writing that stuff are the people that are not working on their mental, emotional, and spiritual health, in my opinion.
And also they're so convoluted. The internet, there's so many different areas that you can dive into. And I think it can become very confusing. And so you're right. I think it is extremely important that you find somebody that you trust to work with to help you. And that only adds to that connection too of, the doctor and the patient, and not kind of getting lost in this big open world of too much information.
Right.
So, I went through that myself of finding a practitioner that I trusted wholly and completely. And I would tell you, my life changed on a dime because it was like, okay, I have these questions. I know who I need to go to get these answered. I don't have to sift through a load of information that is super confusing to me. I can have somebody help me dig into these. And that kind of goes to what we're going through socially anyway, this loss of connection. I mean, you kind of need that with a doctor as well. Somebody you can really trust rather than somebody that's going to shuttle you in and out in 15 minutes and say, take a pill and hide your symptoms and, or say, I just don't know what to do with you. Sorry.
Right.
That's definitely important. I think that's an extremely important point that you just made.
To answer your question though, I have seen a few people that respond negatively to chelation.
Yeah.
But it's like maybe 1% of the people that I've ever treated for heavy metals. So it is possible, but I've just seen it occur way more frequently in somebody that kind of went into it, having read something and questioning it. And then, I mean, usually I'll just tell people, please don't even do it because this is not going to end well because you're kind of already convinced that this is not the right thing.
That this is terrifying or scary. And so how do you maintain, like, once you go through that process, then how do you maintain kind of that less toxic environment and feeling good? What is it that then you have to do? Because I think people get so overwhelmed with the idea of, health is going to be hard. How do I stay healthy? It's too hard. I don't want to have to think about what I eat. I don't want to have to think about how many steps I get in a day. I don't want to have to think about my emotional health. I hear that a lot, even with just like my own clients. Like, I don't really want to think about this.
Right. To me, our health is a decision that we have to make every day. So that's from my own experience in recovery is I am very much a checklist person, and I wrote down recovery on my checklist and I did everything and it was great. And then I relapsed when I stopped doing it. And that's what I see in people. And so it's not easy. I mean, this is the more difficult way. It's a lot easier to mask with pain pills and alcohol and drugs and TV and all this and social media and just not deal with it. With heavy metals specifically, like I usually tell my patients that once we've got the metals out of your body, I think you're good for at least 5 to 10 years before we need to test again.
Yeah.
In regards to just like our environment, I mean, there's so much. There's the 5G, there's EMFs, there's constantly what they're doing to our food supply, the medications. So that, the more you learn about environmental medicine, the more like you just kind of don't know what to do, like go live in a hut in the mountains. It's not easy. So I really like EWG.org, Environmental Working Group. That's a great resource as far as toxins. You can search food and facial products and makeup.
Beauty products are on there. That's a really big one.
Yeah, that's a huge toxic source. So it's not easy. I started writing a second book last week, and in the first, I went through like the first chapter is just like all the things like my wife could be exposed to start her day, and it's pretty terrifying. So you kind of have to do your best, but to me, the most important thing you can do is work on the trauma, work on the mental, emotional, spiritual part, and it'll make detoxing easier.
Right. You almost have to fall in love with your health, like fall in love with how your body works and getting to know how you specifically operate. And then it almost becomes kind of addicting and you want to do it. You kind of get addicted to feeling good and feeling better. But you're right. Like maintaining is difficult, but knowing like upfront that it's going to be hard and you are going to be living differently than probably most people that you know, you have to be okay with that. And you have to be okay with doing the hard stuff. And hopefully maybe you rub off on some people.
Yeah, absolutely.
Yeah. So, well, why don't you tell me how we find more information on you, more information on your book, and anything you have maybe coming up?
Unfunk your gut with a C, funk with a C. That came from a saying that we put the funk in functional medicine at my practice. So that's my book. It's on Amazon, Barnes and Noble. Your local bookstores will not have it in stock, but they can order it if you prefer to go local. It's on Kindle. I'm recording it on Audible. It should be out before the holidays. And so that's to me like my experience and my kind of preparation for people to enter functional medicine, and a lot of tips that they can follow. To a lot of people will heal just through the tips in the book. Not everybody will end up needing a functional medicine doctor, but.
And that's the most fantastic thing I think about functional medicine, is that it gives you a way to help yourself. And I think so many of us really need that, a way to really take our health into our own hands.
Yeah.
So that what you're doing and the work that you're doing is so important. And I'm grateful. And I'm grateful for your time and sharing your knowledge with us and the book. So I will put that in the show notes so everybody can find it. And is there anywhere else we can find you?
My website, doc-koz.com, doc-koz.com. It has my assistant's phone number on there, email address. And so if anybody wants to work with us, just email or find out more info. And I'm on social media on Instagram as doc_Koz.
All right.
So those are the best ways. But through my website's the best way if somebody wants to like work with me or look at all these different toxins they might have.
Fantastic. Well, I appreciate such a thoughtful, informative conversation, and I thank you for your time.
Thank you very much. It's an honor.